everyone. Welcome to tonight's Patient Leader webinar. We are fortunate enough to have patient leader Marla Marasco, who is a patient leader and advocate for the Down syndrome community, as well as an author and a speaker. And I will say she recently spoke at the UN, so she is making moves and definitely changing healthcare. We are so excited to have her talk tonight about how you can become an empowered advocate. And I think this is such a crucial topic within advocacy. We, see all these patient leaders with the passion and, the desire to really make a difference and make a change, but how do you start? It can be a little overwhelming. So we're excited to have Marla here tonight. She'll be sharing, how you can get started, how she did it to get where she is now, and how you can too.
Sure, everybody can see my screen, I hope, at this point.
Yep.
Correct. Okay, well, thank you. Like I said, Kristen said, we're talking about how to be an empowered health advocate. So just a little bit about myself. Recognized Down syndrome parent advocate, author, speaker, blogger, community builder, but most importantly, mom. I'm the author of the book Jacob's Journal, My Journey Home, which you can find on Amazon, published on the Huffington Post, recognized as a WeGo Health Activist Award nominee. As Kristen mentioned, I just was a panel speaker for the 2017 World Down Syndrome Day Conference at the United Nations, named on top 50 mompreneur blogs to follow in 2013. I was listed to the top 100 special needs resources on the web in 2013, and nominated as a finalist for the 2013 Reader's Choice Award for Favorite Special Needs Online Community. So let's jump in to our presentation. So what is an advocate? Dictionary's meaning: a person who publicly supports or recommends a particular cause or policy. What is an advocate through a parent's eyes? This is a totally different meaning. Someone who puts the needs of their child before their own. Someone who works tirelessly to stand up for their child's rights. Someone who isn't afraid to say no. So what have I learned about advocates? That no matter what our child's needs, diagnosis, no matter where we are geographically, financially, no matter the age of our child or us as parents, there's one common denominator. We are a group of passionate people who will do whatever it takes to get our children what they need to live in order to have the best quality of life. Whatever the challenge, our desire is to help our child overcome the difficulties and soar. So now let's take a closer look at how one becomes an advocate. Number one, they need to accept their child's diagnosis. Number two, they need to educate themselves. Number three, they need to get involved. And number four, they need to share their voice. So let's look at each of these closer. Accepting your child's diagnosis. So you've just learned that you just learned of your child's diagnosis. So what do you do now? First, don't blame anyone. There's no point in that because ultimately it's not going to help your child. Learning that your child may have a health condition or a disability is difficult for anyone to overcome. So take your time, but when you surrender to the disappointment or the denial, you will ultimately see the beauty that's actually right before you. Reach out for support because I guarantee you, you're not alone. There's probably another family who's traveling the same journey as you, so just ask for help, ask for support. And this was easy said than done because I did the same thing when my child was first born, but we don't compare. Basically, kids develop and grow with or without challenges at their own pace. But it's easy to sit there if you're at a support group and look at all the other children and all the other families around you to kind of get a baseline, because this is all new to you, but to get a baseline for either where your child might go, what they can or can't do. But really, you can't compare because you have no idea what your child's capability is until you start getting into it. So basically, you just need to believe in your child. So now let's look at the second thing, educating yourself. There's so much to learn. You ask yourself, where do I even start? Educate yourself by attending conferences. It's a great way to learn about services, products, or organizations that are available to you and your child. Here, this is my husband, Paul, and my son, Jacob, and we are actually at the National Down Syndrome Conference in Indiana. And this was one of the vendors that was there with different adaptable bicycles. And so Jacob and Paul were just testing them out. If your child does therapy, participate in the therapy sessions so that you know how to help them in between each session. Be prepared for doctor's appointments by writing down questions, and then ask for a copy of any report so that you can create your own binder. Even though we are in a digital world, you will get access, and you will get access to a patient portal for your child. Still ask for paper reports so you can create your own binder. Trust me, this will be so helpful for you as you sit down and you start filling out health forms or government forms. It's easy to just have this binder right in front of you to be able to answer some of the medical questions or health questions that you might be getting asked for on the forms, instead of bouncing back and forth on the computer to your child's patient portal. So make sure you ask for any copies of any reports or any kinds of specialists that they might be referring you to. Just make sure you get hard copies of everything. And then by being empowered with knowledge, you will find it easier to talk to professionals and specialists who are treating your child. You're going to save yourself a lot of time and money in your journey by being prepared and having a plan and collaborating with the doctors and the specialists on the best care for your child. Well, what else can you do? Let's look at this. Start understanding the different lingo, whether it's going to be medical or educational. And when you're talking to doctors or specialists or educational professionals, you're going to start hearing different lingos, such like IEPs or 504s. Make sure you start understanding them. Write them down in your binder so that when you attend meetings or any kind of doctor's appointments, you start understanding what the professional is talking about. Know what your health plan covers, so you have an idea of what may be considered out-of-pocket costs. Reach out to organizations that teach parent classes like understanding your child's basic rights or financial planning. Get help with government assistance. If you're actually at the hospital, speak to social workers who can get you lined up with filling out forms for Medicaid and any kind of state or local government assistance. And then reach out to local support groups or find parents that have a child with the same medical challenge or disability. This is a website that you can actually go to if you want to take a quick snapshot of this page, or if we could put this in the notes or the Q&A section to put this website link in so people can start going there to see what local support groups are available in their area. And get familiar with the leading advocates in your community. Follow their blogs, YouTube channels, and here on We Go Health. Now you need to start getting involved. Start getting involved to build your support network. It's important to start building your support network as soon as possible. And start attending community events. This will help you to get to know other parents in your area that may have a child with special challenges just like your child. You need to start developing relationships with other parents. I promise you, this is so valuable. And let me explain to you why. Here's a perfect example. My son has a friend who he actually had in his class last year. They became very good friends. We invited this boy to Jacob's birthday party last year. He's in class with him again this year, so their bond is getting actually stronger. He invited Jacob to his birthday party. Jacob invited him to his birthday party. But the point that I'm making here is that you need to start developing the relationships with the parents as well. It turned out that when we actually signed Jacob up for the religious education class, it turned out that the teacher was actually my son's friend's mother. So just in our relationship through the religious education and our son's relationship, we got to develop a really great, strong relationship, which I was able to use on days when I wasn't able to take Jacob to class. I would be able to call her up and ask her if she could pick him up. So developing relationships with parents of typical children, as well as children with special challenges, is only going to increase the support that you get. So you need to start developing those relationships as soon as possible. And make sure you network at meetings that you attend. You may become passionate about an organization that you might want to get involved with, from volunteering to maybe even a board position. I would suggest that as you start feeling comfortable and you start attending these conferences, bring with you a business card so that you can actually pass them to the volunteers that are there at the tables, at the vendor tables, and ask if you could connect with their director. If you're really, if you're very passionate about this organization, you want to get involved with them, just start carrying business cards with you. This is going to help you to start feeling more confident within yourself when you're out there in your community. Now you need to start sharing your voice. After you've gained all this education, you need to start sharing that now with other people. So I suggest participating in opportunities to educate others, like in the school or at the MOPS groups, the mother of preschoolers, or at churches or community organizations like a diversity group. This is one of the diversity meetings that I was attending. I was actually invited to attend at the Hopkinton Historical Society, and I spoke with a diverse group of people about me being a special needs mom in the community. And my story actually resonated with a lot of people that did not understand what a special needs mom goes through. So share your story, share about your child. Share about your life, about your child, so they can become more accepting of you and of your child as they get to know you better. Encourage opportunities for peers or neighbors to get to know your child so they can grow greater understanding and empathy for them. Schedule play dates. Schedule play dates with typical peers, classmates, kids in the neighborhood. That way they can start getting to know your child and start creating that relationship with them. And this helps them to be able to, advocate for your child as well if they're at school together or out in the community, because they're going to be able to have the knowledge to do that if your child can't. Now I just want to share with you my video from speaking at the United Nations on World Down Syndrome Day.
The next speaker is Marla Murasco. As a Down syndrome parent advocate, author, speaker, and blogger, Marla lives and expresses her passion for advocacy and Down syndrome every day. Dedicated to spreading awareness for inclusion and understanding for the individuals with Down syndrome, she plays a proactive role in her community and in the classroom. Marla has been involved in no-profit work for over 30 years. She is also currently president of the Hopkinton, Massachusetts Special Education Parent Advisory Council, working closely with the school district. Her speech is Why Your Voice Matters.
Good afternoon, everyone, and I'm honored and excited for being here with all of you today on this wonderful day of advocacy, and I'd like to share with all of you about why your voice matters. I still remember how I felt when my son was born, March 22nd, 2006. I was excited, nervous, and honestly, I was scared. All the years I spent volunteering for Special Olympics could not prepare me for the reality right in front of me. My son has Down syndrome. But why was I scared? He was beautiful in so many ways. He was perfect, but all I could think about was how were we going to care for him? How were we going to get him the resources he needed? No books or parent classes could prepare us for the journey that lie ahead. I looked down at his beautiful, innocent face, and I knew then we were going to do all that we could to get what he needed to have for the best quality of life. A whole new journey started for me, that of an advocate. I needed to educate myself, so I participated in therapy sessions, read books, attended conferences, and got involved with our local community support group. As my son entered school, we felt it was important for my son's peers to understand about Down syndrome. That way, they could feel more comfortable as they got to know him and developed friendships with him. At the beginning of my presentations, I would let my son share with his peers that he has Down syndrome. It's important that he knows his diagnosis so he can advocate for himself one day. Share your voice with your community. Help them to understand your life so they can become more accepting of your child and his or her incredible talents. Get involved with your community to help make a difference, not only for your child, but for all children. Help to support causes that can foster inclusion, like I'm doing here, speaking to the kids about an all-inclusive playground that we brought to our community. So why does advocacy matter? So typical peers foster a greater understanding and empathy for their peers with disabilities. This in turn creates friendships outside of school and on the playground as well. Because knowledge of any kind strengthens learning, understanding, and empathy. Advocacy opens the door to belonging to and becoming a member of the community. Your advocacy voice also needs to be heard in school. Work with your child's IEP team to get them the best supports to be successful, because special education is not a one-size-fits-all approach. You know your child best and their strengths, and share them with your school. It all begins with you, as well as early intervention, opportunities for inclusion, advancements in cognition research, and understanding the different therapies that are available to them, because your voice becomes their voice. Thank you.
So that was the presentation I did at the World Down Syndrome Day Conference. I was very honored to be there to present. So I wanted to share that with all of you because it was a wonderful opportunity. Now I wanted to share with you about what a self-advocate sounds like. Let's take a listen to a self-advocate. This is Amy Mullins. She is a paraplegic, and she is a Special Olympics athlete, or she's an athlete, I should say, in the Olympics, and she's also a model. I was listening to her TED Talk, and these were some of the key points that I took from it, and I do want to share a little bit of her TED Talk. She's an amazing self-advocate, and I advise you guys to listen to her TED Talk, but this is the first thing that I got from it. Adversity isn't an obstacle that we need to get around in order to resume living our life. It's part of our life. There is no normal. There is common or typical. Why would we want to be normal? A child will achieve. This is the one that got to me. The only true disability is a crushed spirit. And you'll get all this from her TED Talk, but here's just a snapshot of it that I wanted to share with you guys.
in the town where I grew up in that red zone in northeastern Pennsylvania. And I was standing over a bushel of tomatoes. It was summertime. I had shorts on. I hear this guy, this voice behind me say, "Well, if it isn't Amy Mullins." And I turn around, and it's this older man. I have no idea who he is. And I said, "I'm sorry, sir. Have we met? I don't remember meeting you." He said, "Well, you wouldn't remember meeting me. I mean, when we met, I was delivering you from your mother's womb." Oh, that guy. And of course, actually, it did click. This man was Dr. Keene, a man that I had only known about through my mother's stories of that day. Because, of course, typical fashion, I arrived late for my birthday by 2 weeks. And so my mother's prenatal physician had gone on vacation. So the man who delivered me was a complete stranger to my parents. And because I was born without the stable bones and had feet turned in and a few toes in this foot and a few toes in that, he had to be the bearer. The stranger had to be the bearer of bad news. He said to me, "I had to give this prognosis to your parents that you would never walk and you would never have the kind of mobility that other kids have or any kind of life of independence. And you've been making a liar out of me ever since." The extraordinary thing is that he said he had saved newspaper clippings throughout my whole childhood, whether winning a second grade spelling bee, marching with the Girl Scouts, the Halloween parade, winning my college scholarship, or any of my sports victories. And he was using it and integrating it into teaching resident students, med students from Hahnemann Medical School and Hershey Medical School. And he called this part of the course the X Factor. There's the potential of the human will. No prognosis can account for how powerful this could be as a determinant in the quality of someone's life. And Dr. Keene went on to tell me that, he said, in my experience, unless repeatedly told otherwise, and even if given a modicum of support, if left to their own devices, a child will achieve. See, Dr. Keene made that shift in thinking. He understood that there's a difference between the medical condition and what someone might do with it. And there's been a shift in my thinking over time, in that if you had asked me at 15 years old if I would have traded prosthetics for flesh and bone legs, I wouldn't have hesitated for a second. I aspired to that kind of normalcy back then. If you ask me today, I'm not so sure. And it's because of the experiences I've had with them, not in spite of the experiences I've had with them. And perhaps this shift in me has happened because I've been exposed to more people who have opened doors for me than those who have put lids and cast shadows on me. See, all you really need is one person to show you the epiphany of your own power, and you're off. If you can hand somebody the key to their own power, the human spirit is so receptive. If you can do that and open a door for someone at a crucial moment, you are educating them in the best sense. You're teaching them to open doors for themselves. In fact, the exact meaning of the word educate comes from the root word educe. It means to bring forth what is within, to bring out potential. So again, which potential do we want to bring out?
So again, that was Amy Mullins, and her presentation or at the TED Talk was The Opportunity of Adversity. And I wanted to share that with all of you because I just thought that was so powerful. And I think she is an amazing speaker and self-advocate. So I wanted to share that with you. Here is the link to the full TED Talk that she did for The Opportunity of Adversity. Again, if you want to take a snapshot of this, or if we want to put this in the Q&A section, because again, I think it's really important to listen to the full presentation, but I just wanted to share a little bit of that with you. So just in closing, I wanted to share this last quote with you. A community that learns together excels together. We need to form communities that learn together. And I just wanted to say thank you to all of you for allowing me to speak to you tonight. And that is the end of my presentation. So I guess we can open it up to Q&A.
Awesome. Thank you, Marla. Really inspiring way to end that webinar. So I really enjoyed the ending in that video, and I will shoot the link as we go through Q&As. I know the first resource we mentioned, I shot it in the chat, but I also shoot the rest of that TED Talk link. The first question, this is a good one. It's from Jack. What have you learned from advocates in other conditions?
Basically, it's what I have actually learned is some people are not ready to share with their child about their child's diagnosis. And I didn't understand why that was, because I actually thought it was important for them to know, just like I mentioned that it's important for Jacob to understand his diagnosis so that he can learn to start advocating for himself. So I was actually interested to hear that. And that's actually took place at our CPAC meeting here in Massachusetts, which is a Special Education Parent Advisory Committee. And I was kind of surprised that why they wouldn't share that. And I think it's because they didn't quite understand the diagnosis themselves. They hadn't come to terms with the diagnosis yet. And I think that's kind of what my whole presentation is about, that you need to come to terms with the diagnosis and you need to get past that denial, because that's the only way you're going to then open up to start being able to advocate for your child. So I think it's very important to educate yourself and really try to understand the best you can so that you can supply your child with that information and the community.
That's a great point, and something that we all, I hope, would admire to do so. But what happens when, you know, those times get tough and you yourself are put down? How do you really, you know, build yourself up to be there for your child or your loved one?
I could give you a perfect example. I was actually at someone's house, and you know, they were just doing small talk, and they actually used the word retarded, and I was very set back by it, because they knew who I was, they knew who my child was. And I'll be honest with you, I didn't say anything. And I was so mad at myself when I went home because I didn't say anything. I was so blown away. I was so taken off guard, like, wow, we actually still use that word in this day and age. But that's the whole point of education, because that told me that person was never educated. Mm-hmm. And yes, that was my opportunity to educate her, and I didn't. And from that point on, I realized that anytime somebody uses that word or puts me in a position like that, I will make sure that they know that they need to use a different word, because that word is offensive not only to myself, but to my son and to the other individuals with Down syndrome that they are referring to.
Yeah, and I think that's very admirable, because a lot of times when it's easy to get angry at these people who aren't educated, it's really, you know, your turn to step up and to educate them. And clearly that's what you're doing, even if you didn't in that exact moment. Clearly your work at the UN and everything is showing that. And it's really incredible, and something that everyone can do for any community, because I hear all the time there's miscommunications, or, you know, people just assume, you know, a lot of times if you don't look sick, you're not sick. Right. The misconceptions are really across a vast amount of communities. And if we can really, you know, group together as patient leaders and take that time to educate these individuals, that's where the change and the magic really happens. If anyone else has questions, I know I got one more, but feel free to throw them in the chat box or the Q&A. We have Caitlin asking, were there any resources you used through your advocacy journey to help you prepare for your presentations, like at the UN, or even for a webinar like this one?
No. Everything was just me kind of recapping my journey. You know, I did go back and look at some of the links for so that I could share them with you people. But really, in all honesty, I was just kind of recapping my journey, because it wasn't easy. I'm sure you all know that. I can tell you from the very beginning this quick story, because I think this will give you somewhere where I started. That when my son was born, we knew he did have a congenital heart defect when I was 4 months pregnant. We did know that. We did not know about the Down syndrome, and we didn't pursue the testing for that. So when he was first born, he was extremely fragile, and I was not prepared for that. Like I mentioned in the World Down Syndrome Day video, I was not prepared for his fragileness, and I wasn't connecting with him. And one of my friends now, who was a nurse at the time, called me down to the NICU where he was at like 3:30 in the morning and told me that he needed a bath and he needed to get fed. And I just had gotten my C-section done, and I was like, okay, you can do that. And she's like, no, you need to do that. And I remember calling up Paul later going, what hospital do you have me in that these nurses And I was like so mad, and I'm hobbling down the hallway, and I get there, and she's like, she kind of showed me real quickly how to bathe them, and she walked away.
Oh gosh.
And I was like, oh my goodness. And then I sat down and she gave me the bottle, and she walked away again. And I looked over at her, and she was looking at me from the desk. And after we were all said and done, she goes, I had to do that, Marla, because you weren't connecting with him. And I thank God to this day that she actually saw my need to connect and bond with him, because I don't know where we would be today. But the point is, it wasn't easy for me from the beginning, but I got past all this, and I knew it was going to be, we needed to form a bond and get a partnership, my husband and I, to realize that we were going to do whatever we could for him. So it's important to get good people in your support network like that.
Yeah. Have you have you worked with companies that design and develop, products for patients with Down syndrome to really advise them ways to improve their experience for patients and caregivers?
I have not, but I would love to. I would love the opportunity to get more into the marketing area of how you market to not only, just special needs moms, but how do you market towards that self-advocate?
Right. And then we have a question that I think a lot of patients deal with. Have you dealt with advocacy burnout, and how do you move past it? Because I know it's something that a lot of our patient leaders struggle with, whether they're putting their health first or they're not putting their health first. They're really trying to keep going, to keep the momentum and help others. But really, it's kind of vital to help yourself and care for yourself so you can be that figure for people. So how do you deal with advocacy burnout?
It's absolutely true. Honestly, it is a full-time job. I mean, I know people kind of laugh and you work from home and you're a blogger, but there's so much behind the scenes that people have no idea that we do. I mean, just my own personal, journey is, dealing with IEPs and conference calls with the schools and advocates and specialists. I mean, it really is a full-time job. And yeah, I do get burned out very easily. And I think it's important, again, to that network. I mean, my husband is a huge help to me. I mean, he knows when I'm done and I need to step away. But I also think that it's important to have those friendships that, I literally just had a hysterectomy about a month and a half ago. So again, how do you handle that? How do you handle having major surgery and caring for a special needs child? Well, again, to the point of the support network, I was surprised to see how many people came to our door with dinners. I mean, my husband looked at me and was like, oh my goodness. I mean, I was so thankful. And that really is because of the relationships that I created, due to the relationships for Jacob. So it's exhausting, but you have to build the network in order to have people to fall back on when you just can't do it that day. Right. And you need to be able to admit, like, look, I need a timeout. I need a break. And you really need to do that, whether or not you do yoga. I have recently just started getting into yoga, and it's actually yoga with special other needs moms. So we do our yoga, and then we use a half an hour of that time just to talk, just to
cool. Oh, that's awesome.
Get involved with Facebook groups. I have a Facebook group, which I'm happy to share with everyone. But I think that's also a way to start creating friendships and support group that, although they may not be in your backyard, you feel comfortable with them to just talk, because you really need to talk things out sometimes. And if you don't have somebody physically there for you, it's nice to be able to have that online community.
Yeah, totally. I think it's exhausting, but it's worth it from what you get at the result. But the key is to always, question yourself. Am I doing too much? Do I need a break? And make sure to step away if need be.
Yeah.
We have one last question, which I think is a really great question. how did you explain Down syndrome to Jacob, and what advice do you have for other parents that are trying to explain, you know, their child's diagnosis to them?
I didn't go so much into explaining the whole medical part of it, you know, with chromosomes and all that, although I do speak about it with the schools. When I go into the school, I do have a presentation that I speak about, and he's there listening. I don't know that he knows that part of it, but he knows that when he goes to like his therapy sessions, he's getting extra help. He knows that, you know, he has an aide that helps him because he needs some help redirecting himself or just help in the school. So he's kind of piecing it together himself. And that's why I think it's so important for him to be a part of these conversations. And then I just, you know, keep reminding him that, you know, he does have Down syndrome, and that, you know, he's beautiful and he's powerful and he's determined and he can do whatever he wants to do with that. You know, if he wants to, you know, be a basketball player in Special Olympics. I mean, we expose him to as much as we can, because then from there, he then can start making whatever choices he wants and what he likes to do or and not do. I don't really want to make those decisions for him, but I think it's just important to kind of just keep reminding him that it's okay to, you know, be pulled out for speech therapy and that people are trying to help you and look and empower him to say, look at how great you're speaking right now, or look at how well you're reading that book. I don't go into too much the medical terminology. He is only 11 years old, but I just want to kind of give him a little idea of why he's getting all the supports that he's getting.
Yeah, and I think that's great. And I was lucky enough to meet him earlier, and I would say the politest boy I've ever met. So definitely a sweetheart, and I'm so glad to hear about your journey that you've had so far, because it's clearly been successful and it's very eye-opening for the community, and I think that everyone's feeling very inspired after this webinar especially. So I just want to thank you. I want to thank everyone else. I'm sending Marla's Facebook page. I believe that's the correct one in the chat. If it's not, I know you have two, so I think I sent the correct one. But I just want to thank everyone for joining us tonight. We will have this posted on our blog about a week from now, so don't worry if you'd like to share it with friends. If you know someone who could really benefit from this webinar and this information, you can certainly, share the blog next week. I also want to invite everyone to our We Go Health chat tomorrow at 1 p.m. with patient leader Suzanne Stewart. We're kind of talking about a similar positive theme here, where we're talking about, you know, how to stay hopeful and positive on your patient journey, which I think is something that every patient can relate to and add something to. So we'd love to see you there. And other than that, I hope you guys all have a wonderful night. If you have any questions for Marla or I, you know that you can shoot me an email and I can connect you with Marla. Certainly not a problem there. Great.
Thank you, everyone.
All right. Thanks again, Marla. I appreciate it.
Thank you.
All right. Bye-bye, everyone.
Bye.